afternoon, healthcare delivery at the Kolebu Teaching Hospital has grinded to a halt as a strike by the allied health professionals enters day 5. The group, consisting of 23 health professional bodies at the hospital, announced a strike on Wednesday, July 31st, demanding a seat at management level of the hospital. At the central laboratory of the hospitals, patients needing lab tests are being turned away as the professional bodies say they will not return to work until their demands are met. My colleague Prince Kwame Kudoga was at the Kolebu Teaching Hospital and engaged a patient who came all the way from Agona Swedro and had to be turned away due to the strike.
I'm coming from Agona Swedro. I'm coming for, what do you call it? Lab test at the hematology department. You know, it's very frustrating because considering this long journey and you come here for them to go on strike, it's kind of a stressful situation that what can we do? Nothing. We just have to return and find the appropriate time and come back again.
So you have to go back to Australia?
Yeah.
That should be a strain on your finances.
It's a strain on my finances, but what can we do? I came here unannounced, not aware of the situation. And coming to meet this circumstance is kind of frustrating. So I can't deal with the situation. I have to get back with men, continue with whatever I have to do.
Quite a troubling situation at the Kolebu Teaching Hospital there, but question is, who are the allied health professionals? We mentioned that they consist of about 23 professional bodies, but who are they and what does their strike mean to the Kolebu Teaching Hospital? Joining me in studio now is Dr. Francis Kwache Entry, who is the chairman of the Ghana Federation of Allied Health Professionals, Kolebu chapter, and Edward Ayem, who is vice chairman of Ghana Federation of Allied Health Professionals, Kolebu chapter. Now, grateful to you, gentlemen, for coming through. I hear your demands, or your demand, one of them that I know, is that you have to be on the management board. Is that the only demand, or there are more?
Yeah, so what brought about the impasse was an advert that the management of the hospital actually posted.
Okay.
Over the years, we've been calling for a fair share of the cake in terms of representation at the board and then at management. Thankfully, 2019, it took a nationwide strike to get a representation at the board level.
Okay. For the allied
health. So okay. Over 23 professions and counting. It took a nationwide strike before we had a representation at the board. And once that was done, the ministry actually appointed a director at the ministry to be in charge of allied health professions and our issues, you know, when you go to the ministry. And same is to trickle down to all the agencies under the ministry. Thankfully, the whole teaching hospital and the Tamale Teaching Hospital have actually appointed a director to oversee the activities of allied health.
In the facilities?
In the facilities.
Specific?
Yes.
So first of all, there is a director in charge of allied health at the ministry.
At the ministry, yeah.
That was the first thing that was done. Now, 2 hospitals have also appointed same.
2 teaching hospitals have actually done same.
Okay.
And we were expecting Kolebu to also follow suit. In actual fact, we are of the view that Kolebu has actually delayed, because if you look at teaching hospitals, Kolebu is the mother, and everybody look up to Kolebu. So we were thinking once the ministry actually did the needful, Kolebu would have followed up with same. Only for this year, we saw an advert of a deputy director of medical affairs, and they were deputy director of medical affairs, into bracket allied health.
Okay.
Meaning they were putting us under the medical directorate, where we have argued over the years that we are of age. And so we need our own directorate. And the ministry have actually done the writing. And so we wrote to them that they should immediately withdraw that advert and then advertise for the position of a director of allied health instead of putting us under the medical directorate. And we engaged with them and they refused. So we had to also shake the systems more for everybody to know that all is not well in Kolebu.
Okay, but what difference does it really make if you have a standalone directorate and if you work under the medical directorate?
So
maybe I'll bring you in here.
Okay.
Yeah. So really, it makes a lot of difference. Over the years, we have been under the medical directorate. Now, let me let you understand that we have the doctors. When you come to the hospital, we have the nurses. The doctors have a directorate. The nurses have a directorate. The pharmacists have a directorate. Now, for the clinical setting, we have the allied health professions that we have already said consists of about 23 and counting professions. And this last group of professions have existed under the medical directorate all these years. And the truth of the matter is that we've always had the short end of the stick. We've always been given a raw deal. And so we are not giving of our best. Our output is hampered because we of course, the doctors are many. They have many subspecialties. So when he goes to the medical director goes into a meeting and has to take decisions for not only his doctors who have many subspecialties, all of them, and he also has to attend to us. It becomes, of course, if there's some priority, he will give to the doctors. If there's some consideration, he'll give to them. I mean, come into the hospitals and you see that vast difference. Okay, so now we are saying no. That has gone on for too long. It is time for an allied health directorate. If the ministry has found it necessary to put us on the board, which supervises the management, why should we not be at management to help implement decisions taken by the board? So if the board says, let's do this in the next couple of years to help the hospital, to build the hospital, we as allied health should also bring our input. Okay, this is what we can do to help attain that vision. But when the doctors go sit down and talk for us, and to tell you the truth, most of them don't have an idea what we do. I mean, they have ideas, but they don't know exactly what we do. And we are struggling. The hospital is struggling. I can tell you that in Kolebu Teaching Hospital, we have, and I am a radiographer, okay, and I'm in the head of MRI in Kolebu. Now, we have a CT scanner, a 640 slice CT scanner. There are 3 in Africa, and Ghana has 1. This machine in Kolebu has been down over 5 years.
5 years?
Over 5 years.
The MRI scanner?
The CT scanner.
So that's for cancer patient, isn't it?
No, the CT scanner is for every patient.
Okay.
It's for every patient. The CT scanner we have currently in Kolebu does not belong to Kolebu. It's for a private individual. It's a PPP that is in Kolebu that we are using. Kolebu does not have its own CT scan.
And yours broke down 5 years ago?
5 years ago. So the question is, who is really interested? I mean, as for MRI, I'm sure people have been hearing how often MRI goes down and patients have to be going out. You know, we have to be transporting patients, the cost of ambulance to get patients to the various other places, the inconvenience. Our roads are so bad. So a patient is in ICU, needs a scan because our machines and all are not being catered to properly. They have to be carried all the way to a particular place and brought back. You can imagine what our patients are going through.
What did management tell you about that machine that has broken down for 5 years?
Because we don't have a voice there. It is a difficulty. I can tell you that at one meeting, the director of medical affairs came to hear from me. And I've never been, to any of the meetings. That the MRI, for instance, which people had informed him to be scrapped, didn't need to be scrapped. I mean, and when I spoke about it, he got to understand that he'd not been getting that information. Okay, he'd not been getting, but Other people are speaking on an issue that I am on top of, and I have not been speaking about.
What will it take for that machine to be repaired?
It won't take much. The machine generated money when it was working. The machine generated money. Where is the money? Where is the money the machine generated whilst it was being used? Okay? And these are issues that at management level can be sorted out. If we have a voice there, if we have a director who is sitting there, he knows what we are about. One of us, not a medical doctor, not a medical doctor, one of us sitting at the table should be able to speak to the issues and speak to them well. And because we know it is us, we are able to appreciate each other. The doctors don't respect us. That is the main crux of this matter. Otherwise, we shouldn't be here. We shouldn't have gotten to this point. They are the head of the medical team. Unfortunately, they have not played their role as heads adequately. And everything has been just about them. Everything has been just about them, you know, and we seem to just be getting the crumbs and all of that. At this point, we are saying, enough is enough. We have come of age. I mean, we were told by our board that they can only give us a directory, a deputy director, because we are not of age.
So I mean, as of the price, because maybe someone is listening to us, and the amount to repair that machine, somebody is listening. You know, there are lots of good people around. I say so because there was this boy we needed operation for. Someone paid outrightly for him. Other people supported. That's how. So how much do we need to fix that machine?
Oh, currently, according to the engineers, it would require about $1 million plus.
$1 million plus cedis.
Yeah, dollars.
Dollars.
Yeah.
Whoa.
Yeah.
How much is the brand new machine?
The thing has been lying down for over 5 years. I'm sure even if now they come and do a current assessment, it might even be more.
So the 5 million is as of 5 years ago?
No. I mean, in the intervening period, I've asked and I've been told something in that region.
How much is the brand new?
Okay. A brand new CT scanner, we are talking almost $1 million.
Almost $1 million?
Yes.
Then of course, it will be good to buy a new one than to repair, isn't it?
Of course, if it is.
Okay, all right.
If there's a need to.
Aside that, what other machines are down because you don't have a voice on the machine, on the management, on the table?
Oh, if you come to Kolebu, currently we have only, in the main radiology department, we have only one X-ray machine working.
Hey, the whole of Kolebu?
So we have one at the child health department. We have one at a chest clinic. The one at the polyclinic is down. And in the main hospital, only one machine is working. So you should come and see patients queue. You should come
X-ray.
for X-ray. For X-ray. For X-ray. We have over 8 machines that are down, that are just lying down. For just X-ray. It is a sad situation, my brother. It says, if you go to the lab, it's the same story. You go everywhere, it's the same story. Why should that be? And most of these machines were given to the hospital.
Free by some people. How much, the X-rays, how much does it take to repair one? So it means that there's a lot of challenges that, do you have so many? Do you have private persons providing the services for the X-rays and co on the premises?
In Kolebu, that is becoming the issue now. Now they're setting up some private places, okay? But for me, the point is, if we have something that is for the nation, that is for us, even if we want to have something on the side, let us take good care of what we have. Let us take good care of what we have, because obviously you know that in the government hospital, it will be cheaper than out there, okay, in the private sector. Why would we want poor Ghanaians who are already suffering so much to go through more suffering? So now you come to Kolebu, you are giving a request, and the doctors will boldly write on the request where to go outside Kolebu. Yes. They would, and this, you know, is an illegality. It's an illegality. It shouldn't be happening, but it has become the norm. They would write, go to this particular facility, and even put their phone numbers and all of that on it. That has become the stock in trade now. And if you dare go and bring a result from somewhere else, you decide to do it in Kolebu, and you take it, they'll tell you they don't trust the result.
Oh, if you do it in Kolebu,
I am telling you,
they will tell you.
Let me
And you confirm that they will tell you they can't trust it.
So let me put it on record that it is not all doctors.
Okay.
Okay, the moment you box in doctors, you miss the point. It is not all doctors.
Okay.
In fact, if you are to take in percentage, you have about 90+% of doctors doing the right thing.
Okay.
So we should get that
So
perspective
there's about
right.
10%.
Some small 10% will tell you you don't trust your results. Not because your result is not trustworthy, but because of other factors. So you can actually paint the cat black and kill it, right? So that story has to be told in its rightful perspective. Now, when it comes to...
But it's shocking that there are doctors in Kolebu who won't trust medical examination results coming from Kolebu itself. That's dangerous.
It's dangerous. And you see, it is good that they are in the minority.
Yeah.
Okay? But the point is that if you have a directorate that is actually collaborating with other directors, those issues will come up at the top.
What will your directorate really change?
So for a directorate, your director will have to make sure that in terms of the personnel, you are well trained, right? In terms of the specialty, you are sponsored to go and further your education, to come and improve upon the system. Over the years, where we are currently, if opportunities come, those people who are chosen to go will eventually will not come to add any value. For example, there's a training on medical laboratory, and you send a physician for those training, and he comes and the person is sitting in the consulting room. What will the system benefit from that?
Yeah.
It is because you don't have a director there who will speak for you. When opportunity comes and it's X-ray, and you don't even get to hear about it, at the end of the day, it means that you don't have one of your kind over there. And you see, this is natural. If a nurse is speaking for a scientist, obviously you don't understand the terrain. And the fact that you are, let's say, a nurse, and you have done, let's say, a specialist course in my area, in the arena of medical laboratory, okay, it is to help you to manage the patient at the ward, and not to come to the laboratory and say you are coming to head Lord over me. That is a misplaced priority. Okay. And so when you have gone to do a specialty in any of the fields, it is appropriate that that knowledge should be applying to the patient where you interface with them, and not necessarily in the medical laboratory. Do you get it?
Yeah.
So for me, I have studied pharmacology as part of my training. Does that mean I should come and sit at a pharmacy,
No.
to dispense? No, that is not it. But it will guide me when I'm doing my microbiology sensitivity testing for the drugs. I'll be guided. When I see that the patient is on this antibiotic, I have knowledge of it. Okay? So knowledge has come to the point where we collaborate. And that is not to be said that when professionals meet, one should be subservient to the other. And that is why we are saying that, okay, let's have a fair representation at the top. And then when we are arguing, if we are looking at the future for the hospital, I can contribute what is needed in terms of our field for the hospital to become the best in terms of choice.
Okay.
And so it is a good call by the allied health professionals. And this shouldn't have taken the strike action for us to be heard. Like my brother said, if management doesn't respect you or the system doesn't respect you, when you even put in good measures, it is disregarded. But we are saying that time is past. The time when people were begging for inclusion is past. It's long overdue.
The time when you were being fed with crumbs, like you said.
It is long overdue.
But what do you mean by that?
You see, like my brother said, we have become an afterthought over the years. Okay? So even when it comes to building a hospital, they will finish with or the building. They will not even consider, let's say, the laboratory or X-ray or, issues of allied health. It is after they finish, then they say, oh, we will do lab. Then they will give you just a room that you should go and operate over there. Those era is past and gone. Now we are saying we are major stakeholders. When you come to allied health, we are the largest in terms of professionals working within the hospital.
Professionals make up. You mentioned something.
So if you come to allied health, we have medical lab in there, physiotherapy in there, and I believe when I mentioned that you appreciate what they do. You have optometry over there, you have dietitians over there, you have radiography, then the radiography, we have therapy, radiography, those involved with cancer treatment and all that. We have a lot. We have a lot, about 20, and it's still counting because day in, day out, it's been added on. And you've boxed us together into allied health. Give us our fair share of the cake. Let us talk for ourselves. You said, no, you should still be under a medical directorate. Now, thankfully, management of Kolebu and the board have actually admitted that we deserve a directorate.
Okay.
And they have written to that effect. Do you know the impasse now? They are now saying, okay, we will give you a directorate. So we've created a directorate for you. But we are going to appoint a deputy director for the main tower. Say, what are you talking about? It is the same disrespect we are talking about for 50 years.
Because the deputy director won't be on the management, right?
And they are saying, oh, no problem. Your deputy director will report straight to the CEO. Your deputy director will be at management meeting. I say, So I give them this analogy. Suppose the presidency calls that they need directors to come for a meeting at the presidency. Then I'm the security guy over there. Then you get there and say, show me your card, and then your card is being deputy. Who the hell, what do you need over here? What are you coming to do here? I said, directors should come. Okay. I said, oh, I'm a deputy director, but my board told me that when directors are going, I also, Master, what kind of logic is this?
Okay.
And then when you talk to people who are objective minds, they will tell you, how will you create a directorate and appoint a deputy? Whilst Tamale Teaching Hospital and the Ho, which are relatively smaller teaching hospital compared to Kolebu, have appointed directors over there. What are you trying to tell me? It means you don't still respect me. And you want me to function properly at the hospital? No. So that is why we told them that enough
is enough.
Is enough. We can't bear it anymore. Okay. Our forefathers actually fought. Now we are saying we can't bear it anymore. It is independence now. And I think today is
it's a founders holiday.
Founders holiday. We are saying independence now, not tomorrow or next week or 1 month to come.
It should be now.
It should be now.
Okay. Now, my production team is telling me that you have a meeting with the NLC about this particular matter.
Yeah.
Why did you get to the NLC?
So the board of Kolebu and the management actually wrote to the NLC appealing to them to intervene because we were going on a strike. You know, that's how come the NLC got into the situation and actually wrote to us to invite us to meet with them.
Let me chip in this. It is an irony, okay, that the board and management that can appoint what we deserve, they've run to NLC to intervene. To intervene for what? You have the power. The board has the power to appoint, right? And then you go to NLC that, please, I beg you, come and intervene because these people are going. It doesn't really add up.
Okay. NLC would obviously expect you to call off the strike whilst you negotiate. Is the strike going to be called off or is still on?
So thankfully, before we even came here, with the respect we have for the NLC, we have called off the strike officially.
Okay.
So tomorrow, our members will be going back to work. Even though some have traveled, actually, I had calls from other friends that because of the holidays and then because we were on strike, some have traveled far and wide. So maybe by Wednesday, effectively, everybody will be at post. But officially, tomorrow we are going back to serve our clients.
So and if I come to Kolebu, I'll come and see you there.
Tomorrow, because we are going to meet with the NLC at 11, in the morning you come and see me there, but around 10, I'll have to leave for the ministry.
All right. And your members say they would obey? Those who have traveled will come?
Yes. So, in actual fact, we need to thank our members. Some sent me a message that their hearts are broken. And I told them that, no, you don't have to be heartbroken. They were urging us to go full length. But we were telling them that, look, the NLC is the mandated body to actually intervene for us to get what we want. And we believe that when we go there and we argue our case, the NLC will probably tell Kolebu to go and do the right thing.
Okay.
Right.
So let's see how this will come. But the breaking news is that the allied health professionals have called on the strike, effective today. But I mean, the implementation will start tomorrow, but effective implementation will begin on Wednesday. So we look forward to see how it goes. But are we expecting that your colleagues in Komfo Anokye Teaching Hospital, in Cape Coast, in Effiang Kwanta may probably begin to call for same? So
thankfully, let me state that the current minister, Dr. Bernard Okoboy, has done well. When he heard it, actually, he wrote to us on Friday.
Okay.
We had a letter on Friday that we should give him up to 7 days for him to resolve it.
Okay.
The only challenge membership had was that it's been quite too long.
Okay.
So for over a year now, almost a year, around last year, November, we wrote to the board. They didn't give us audience. So our members felt disrespected.
Okay.
And that is why they were bent on going on with the industrial action. But then Dr. Okoboy has actually given his word that we should give him 7 days. That 7 days will expire on Wednesday, God willing. And we are hopeful. For me, I trust him. He's a good friend, actually. I trust that he is going to do the needful. He will intervene. In some communications we have cited, he has not directed just Kolebu, but the entire teaching hospitals in Kolebu, those who don't have the director for allied health. And even the ministry, Ghana Health Service, he has directed all their boards to make sure they appoint director for allied health. So I will say Ayiko to the minister. He has done well. All we are waiting for is the implementation, and it should be happening within a reasonable time period. Okay. We want it now and now, not tomorrow.
Okay. All right. So that's a win for the allied health professionals. Thank you very much, gentlemen, for coming through.
You're welcome.
Well,